First tonight, the COVID-19 surge in Indiana continues. The State Department of Health confirms 4,213 additional cases of the coronavirus. More than 214,500 people in Indiana have been diagnosed with COVID-19 since the pandemic began. The Indiana Department of Health also reports 34 additional deaths. In total, 4,418 Hoosiers have died with the coronavirus. Data from the state shows that 30.4% of Indiana's ICU beds are available. That's about the same as yesterday.
Doctors and healthcare workers on the front lines of fighting COVID-19 are not invincible. They too are struggling during this time to avoid burnout and exhaustion while continuing on as COVID-19 heroes. WRTV's Troy Washington speaks with a doctor who explains the struggle.
Things are very different for everyone. There is a lot of exhaustion. It has been really challenging.
For 9 months now, Dr. Lindy Hayes has been locked into treating and saving patients diagnosed with the coronavirus.
With full body gear and full body suit and gloves and multiple jackets on and all of that. And it can get exhausting. You know, you can sweat in there and you can get dehydrated because of that. And then when you're in patient care areas for 12 and 14 hours at a time, it can be difficult to get out, get a break, go get something to eat, get something to drink.
She says it's become about remembering to do the little things to keep going, like eating, staying hydrated, and creating more time for self-care.
Sometimes your vacation is just making sure that you get enough rest.
Dr. Hayes used to look forward to getting away to enjoy a trip, but even though she isn't traveling for leisure right now, she hasn't forgotten the importance of taking breaks.
Sometimes it is overwhelming, so sometimes we have to turn it off.
In order to stay fresh and at her best.
As fatigue increases, what happens is that you increase the likelihood of medical errors.
She says, make no mistake, fighting COVID-19 for long hours and days has made her more intentional about getting rest and disconnecting on downtime.
It is really requiring a lot of specific and targeted intentional acts in order to be able to combat the fatigue and the level of depression and sadness that we experience when we see so much sickness and so much death on a regular basis.
She says she took an oath to help others, and it matters especially during times like these. Working for you, Troy Washington, WRTV.
Dr. Lindy Hayes says that most frontline workers have the added stress of worrying about when they are at home and being around their families after being on the front lines.